The latest numbers show flu cases are lower this year globally, but experts are still worried about an influenza and COVID combination overwhelming U.S. hospitals.
Since March, the activity has been pretty low.
Dr. Wenqing Zhang runs the W.H.O.'s global influenza program. She tells Newsy globally, influenza activity is actually at lower levels than expected for this time of year.
Some of the influenza was circulating in Southeast Asia. In the western part of Africa also, where the very low circulation of influenza B and influenza A, H3N2.
Zhang says that physical distancing, hand washing, and mask wearing in public is also likely slowing the spread of the flu. In the Southern Hemisphere, WHO data shows the season remained low or below baseline. Even with increased testing for influenza in some countries, very few detections were reported. But Dr. Zhang, like many of the health experts we've spoken to, says the influenza virus is unpredictable. That's why hospitals in the U.S., the CDC, and the American Medical Association are still worried about flu and COVID-19 colliding this fall and winter.
We have different treatments for each of these diseases that in many ways are non-overlapping.
Dr. Ben Singer at Chicago's Northwestern Medicine tells Newsy that while it's rare, patients can get COVID-19 and influenza at the same time. And the way doctors treat both viruses can also collide.
We know for patients with COVID pneumonia who have severe disease requiring oxygen that steroid medications like dexamethasone are beneficial. But there is a suggestion in the literature that steroids for severe influenza may actually be harmful.
Right now, the best thing experts are saying, keep doing what is good for slowing COVID-19, plus get a flu shot. Dr. Singer adds testing is key.
We keep emphasizing the need to have widespread access to rapid diagnostic tests so that we can rapidly and accurately determine when somebody presents with those types of symptoms who might have COVID, who might have influenza, or who might have another respiratory virus.
Right now, there's a handful of FDA-approved tests that can both screen for influenza A and B and the virus that causes COVID-19. And since the flu and COVID have almost identical symptoms, health experts say if you do feel sick, call your doctor and ask to get tested for both. Lindsay Thies, Newsy, Denver.